Alright guys, welcome to the last module of the BioWorks course, and this is module number 8, and it's going to concern biomanufacturing production. But quite honestly, all of this module is quite a bit of review. I mean, that's really kind of what this is all about. So a lot of these kinds of things that you're going to see us talk about in this lecture are going to be things that we're pulling from in modules 1 through modules 7. So there's going to be quite a bit that's not going to be new. It's going to be a review. These are going to be terms that you've heard before, but now this is our chance to kind of just wrap it up all together, touch base with it one more time, and then make sure that you have a really good grasp of what BioWorks and biomanufacturing production is all about before you leave the class and earn your certificate. So that's really what this lecture module is. Now, with that said, I want you to tell you that there's going to be new information. So I need you to watch the lecture videos, and I need you to take notes, and I need you to pay attention, and I need you to do good on those quizzes, on those tests, but at the same time, a lot of it is going to be a review. So manufacturing and production, if you go back and take a look at the other modules that we've discussed, it does concern quite a bit of different areas and different moving parts that make this whole process work. So first off, we're going to have to take a look at what we call receiving materials. So manufacturing and production will include positions that are at these companies, and their job is to receive materials, and that's all that they do. So therefore, I'm working in like a shipping and receiving room, and we are getting deliveries and we're shipping things out, of course, but with those deliveries that are incoming, I'm just double checking them, making sure that they're all kind of there. It is what we ordered, and making sure that it kind of goes to its home until it's ready to be used. After the company receives these materials, after they check them to make sure they are kind of what they are, then the second piece of the manufacturing puzzle is now we're going to have to manufacture the drug substance. So this is either going to be what we would call a small molecule API, which is active pharmaceutical ingredient, or this is going to be some type of bioproduct, and that bioproduct will be in the terms of like fermenting and bioprocessing, where we're using some type of bacteria, some type of yeast, something living organism-wise in order to make and produce a drug product for us. So all of that has to happen in the drug facility at some point in time, and it might not be at the facility that I'm working with, but a facility is going to have to do this for us. Maybe my location that I'm working in is really just taking that material and packaging it or doing something else with it, but at some point in time, someone is going to have to make the actual drug. All right. Number 3 is compounding, and compounding is another area that we need to talk about. We haven't really kind of given it its due yet, but we will in this lecture module. And compounding is all about this idea that I'm going to take the API, whatever that API might be, plus other stuff. And that other stuff is the idea that I am mixing and I am blending and I am doing something in order to get it ready to the later stages of the drug development process. So the manufacturing of the drug substance is simply just the active ingredient. And then the compounding piece is going to come in, and it's going to take that active ingredient and it's going to mix and blend with other things in order to make those capsules, in order to make those tablets, in order to make those liquid injections maybe that you're going to be taking as a consumer in the end. Number 4, manufacturing the actual drug product itself. This is where everything comes together, and what that means is that this now is getting closer to the true product in the very end. And after that product is blended, mixed, formed, and done what we need to do with it in-house, then number 5, we're going to inspect it to make it sure it looks okay. Number 6, we're going to go through a labeling process to make sure that it's labeled the proper way, that the right label has went on the right box. Number 7, we're going to take a look at packaging. So we're going to have to put it into a box. We're going to have to put it into some kind of foil blister pack, or something has to happen here as far as packaging goes. So that way we can get it out to those pharmacies or to those consumers. And number 8 is distribution. So how does it leave the facility, and how does it end up going where it needs to go? And then who's in charge with that? What type of documentation documentation is going to be kind of involved in that entire process. So overall, there's many steps to the biomanufacturing production setup. And again, we've talked a little detail about some of these areas, maybe not all of them, but for the most important core ones, we have at least briefly mentioned them and talked about them, of course. Here's the common flow of what we would call the manufacturing process. So just as we kind of discussed just a few moments ago, we get receiving materials that come into the company first, and those receiving materials go into what we call quarantine. And quarantine is the idea that we're going to hold those in an area. We're going to give some time so that way we can do some tests on those ingredients that have showed up. And we want to make sure that those ingredients are safe, that those ingredients are what they say that they are. And we're going to have to do some lab tests on them before they are cleared out, and that does take some time. So these receiving materials will go into a quarantine area or a holding area until those laboratory tests are completed. So these laboratory tests are commonly done by our maybe chem tech graduates or a 2-year degree biotech graduate. Those are the types of tests that they would be doing. That's what they would be trained in. They can also hire, of course, bachelor's and master's and PhD candidates as well to do some of the testing with. But at the same time, associate's degree candidates here make a great benefit to these companies that need that raw material tested and approved before we turn it loose and before we actually use it to make anything with. After those have been tested and after we go ching ching, good job, these are great, then we're going to release those materials and we release them into the drug substance manufacturing. And notice they put an abbreviation here of API. A is active, P is pharmaceutical, and I is ingredient. So if these are a small molecule API, then that is okay. All this is a little bit of synthesis, a little bit of chemistry, a little bit of mixing and blending, and then we go on further into the flow chart. However, if this is a biotech type of product, then what you're going to see here is that an upstream process is going to have to happen. So that upstream process is basically gathering that biological material that we want to use. We're going to grow that material. We're going to ferment that material. We're going to nutrient that material so that way we can keep it growing, keep it alive, and keep it making a product for us. So all of that is going to be the upstream part. And then, of course, after that is a downstream area. And the downstream area is going to be all of the filtration, all of the purification steps that are going to be needed. So that way we can get just that active pharmaceutical ingredient in hand. We want to get rid of all of those impurities. We want to get rid of everything that's not supposed to be there. So at this point, after the downstream process is finished, then hopefully we do have just the active pharmaceutical ingredient, but a biological type of material has helped me make this. That is what this is all about. After we get the API, after we make sure that it is what it is good, it's ready to go, we're of course going to quarantine it first, and we're going to do lab testing on it, of course. So we're going to go back to those chem tech people. We're going to go back to the biotech people. We're going to go back to those laboratory trained personnel, and we're going to say, listen, this is our API. We want to make sure that this API is actually good and it's ready to go. All right, so let me give you an example. Let's say the receiving materials are going to be all of the ingredients in order to make the cake. So I'm going to test those ingredients, and I'm going to make sure the sugar, the eggs are eggs, the flour is the flour, and it's all-purpose flour, not self-rising flour. And I'm going to go through the checklist to make sure these are okay. All right, well, after that, they get released, and then we need to kind of go in and make the API. That API could possibly be the cake that we're trying to make. So once I kind of get that cake made, then this is an active pharmaceutical ingredient, and I need to test that cake. I need to make sure that that is what it's supposed to be. So I'm going to check for a couple of different things, the look of it, the flavor of it, and blah, blah, blah. All right, well, drug production is no different. So these are raw ingredients that's going to be used in order to make stuff, and then maybe instead of making cakes, I'm going to be making something like aspirin here. That's a small molecule. So that aspirin is going to be made and synthesized, mixed and blended, cleaned up, done whatever. And then before we use that aspirin later on to make those tablets with, we're going to have to quarantine that product. And that quarantine is going to allow us to do more testing. So we're going to test that material and we're going to make sure, is it aspirin? Is it pure? Are all of the physical types of tests that we can do to it matching up? I mean, is everything kind of getting checked off that needs to be checked off here? Because at this point, I'm assuming I have aspirin and I have a clean product of aspirin. If that does clear out and if those tests are great, then that's good. That means the released API can now be used to do things with. So what you'll see here in this next step is the dispensing of the API and all of the excipients. Now we're going to talk about what these terms mean here in just a second, but now this is the step where I'm taking the aspirin and I am mixing it with other things at this moment in order to get me closer to the product that I need to make. And that could be the aspirin tablet that you're buying as a consumer. All right, so how do we get to that point? Well, that dispensing of the aspirin plus the excipients, whatever fancy term that is going to go into a compounding area, and that compounding area is going to make, that is the purpose of the compounding area. It's going to make the actual drug that I want to make, and that eventually is going to get us into what we call the finished dosed manufacture. So that means we're getting close to what a tablet looks like. We are getting closer now to what they look like when you open up those aspirin bottles and you dump one out into your hand. This is the finished dose. So now what's going to happen is that this eventually is going to go into quarantine yet again. And the reason for that is because let's say that this finished dose is going to be a tablet. We're going to have to test that tablet because we've tested the active pharmaceutical ingredient. That is okay. That's not giving us a problem. Now we've mixed it with these other things. Now that we've pressed them into a tablet, we need to test that actual tablet as well. We need to make sure the tablet brings the properties that we want it to bring to the party. So that is the finished dosage manufacture, and that is why this goes into quarantine again, because now what we're looking at is the tablet itself. We know the aspirin's pure. We know all of the other ingredients were okay, but now we have made a tablet that someone's going to swallow. So maybe I want to test the hardness of that tablet. Maybe I want to test how that tablet breaks up in a disintegration test. Maybe I want to see how it dissolves and how it releases the active ingredient in a dissolution test. So there's different things that we can do here at this stage of the setup, and this is what we would call the finished product. All right. So once we get the finished product, we're going to quarantine it, we're going to test it, we're going to make sure that is okay, and then finally, if we do get the okay with that, it's finally going to go into labeling, it's going to go into packaging, someone's just going to double check to make sure everything ching ching works off and it looks great, and then finally it goes out for shipping. So we're going to leave it, we're going to let it leave the company or the facility, the manufacturing plant that I'm working in, and then it's going to go to the next stage, and that next stage could be a number of different areas, but it's going to leave the facility because we've done what our job is supposed to do. All right, so up here at the very top in this picture, you can kind of think of this as the raw ingredients. This is kind of or raw material. So this is where it all starts, and we get these materials. We're going to use them. We're going to mix them. We're going to blend them. We're going to do some reactions with them. Whatever the case might be, those are the raw ingredients that go into making the cake. And then finally down here at the very bottom, this would be something like a finished product, okay? So this finished product is really kind of what the consumer would see, and we need to test that. We need to make sure that that is also good at the very last stages of this entire production type of process. Next slide, you're going to see a couple of different categories of drug types that we can talk about. And again, some of it's going to be a review. So the first one up here at the very top is aseptically manufactured perennial drugs or parenteral drugs, tomato, however you want to say it, but they're out there. So these perennial or parenteral drugs are going to be injected through IVs, and they bypass your kind of primary immune system. So these types of drugs are going to be administered through some type of injection or some type of inhaler, and that's going to bypass your main immune defense. So this is something that we talked about in the last module. We brought up this aseptic technique in the last module. We talked about it quite a bit and why these things are so important. We have to make sure they are super clean before we give them to a consumer. So they can be small molecule, absolutely. They do not have to be a biological type of material. They can be small molecule, but as long as they are getting injected by an IV or by a shot or by an inhaler, they're going to go under this classification, and we have to make sure that we handle those with care, and those are with aseptic techniques. Absolutely. All right. Then number 2, down here at the very bottom, we get the large volume perennials or the parenterals. So these types of materials are going to be large quantities, and I want you to think of saline bags here. So if you were in the hospital and you were in the hospital for a few days and you were dehydrated, they would hook up an IV bag to you, and they are administering that through your IV. That is what we would call a large volume. That saline solution bag is a large volume because there's a large amount of material in there and it's still going through an IV. It's still getting injected into you. So because of that, aseptic techniques have to be used here as well. And again, I will often say parenteral, but other people will say parenteral. So whatever you want to say, it does not matter. I don't really care. I just think the parenteral is a little bit easier to say for me. And for you, it might be something else. And that is okay. This is me. I'm from the Appalachian Mountains, and I do say Appalachian, not Appalachian. So now you can kind of see why I say some of the words that I say. And by the way, it is Appalachian. It is not Appalachian. Ooh, I'm fancy. I'm going to say Appalachian. No, it is Appalachian. Go ask any of those people that live in the Appalachian Mountains, and they will tell you it is Appalachian. All right. Next up is oral solid dose, and that's going to be up here in the top right-hand corner. So oral solid dose is the idea that things are not going to be injected by shots. Things are not going to go through IVs. Things are not going to be inhaled, and your body's primary defense or immune system will kind of kick in if there is a problem with these oral solid doses. So keep in mind, with these types of products, they are often put inside of what you would call a pill bottle, right? And that pill bottle is just loose tablets, and there's nothing fancy around them. And you just open them up all day, close the lids all day, get in with your nasty fingers, grab one of them, pop them into your mouth. So the issues here that we would see with aseptic required types of drug manufacturing does not necessarily show up on the oral solid dose side, and that's because you are ingesting it in a different way. So very often these are taken by mouth, and your immune system will help fight off any of those germs. Just like you are eating and drinking throughout the day with your nasty old fingers, well, your body is fighting off all of those germs that might encounter inside of your mouth, and as it goes through your stomach, and of course as it absorbs throughout your body. So oral dose is no different. So that's why, again, these are open bottles. They are not completely sealed. They're not individually packed. They're not kind of kept in a sterile condition the entire time. That is not what oral dose is all about. Finally, number 4 category is biotechnology products. And a biotech product is anything made from a living system. And that living system are things that we've talked about already in the previous modules. Those can be yeast. Those can be mold. Those can be bacteria. They can be anything they don't want to be. They can be virus particles for all I care. It does not matter, but these are made from living systems. So if you are using some type of cell in order to make a drug product or some type of biological-like material in order to make a drug product, you are in the biotechnology sector. Now, that does not have to happen every single time. So up here at the top, this oral solid dose, these easily can be small molecules, which means we do not need help from these biologicals in order to do that job. But there is a chance that we do. And the more complex that type of medication is going to be, it probably is going to require a little bit of biology and a little bit of living cells in order to do that work for me. Dosage forms up here at the very top is just really a quick review of the types of materials that you would see in a biomanufacturing plant. And if we want to kind of stick with our gastro and enteral or enteral, so gastroenteral, gastroenteral, again, perennial and parenteral, whatever floats your boat. We're going to look at tablets and capsules and liquids and suppositories. All of these are going inside of an orifice, and that orifice could be your mouth or something else. But either way, these types of materials are going to make it inside of your system, not through the route of an injection, not through the route of an inhalation. So we are taking them, we are swallowing them in some roundabout way, and we're kind of making them go into our stomach and get absorbed or get absorbed somewhere else, but it is not getting directly injected into our systems. So we often call these systemic, and the reason we call them systemic is because it really targets everywhere. There is no one specific place that these drugs will gather to. So therefore, it's going to be absorbed and it's going to go to where it needs to go. It is smart enough to do that. Your body's smart enough to be able to use it, but we call them systemic drugs for that reason. Now, the only drawback here is that if I'm going to take it and if I'm going to swallow this aspirin tablet or acetaminophen, Tylenol, Motrin, Aleve, whatever the case might be, or a prescription medication from the pharmacist, then it's got to be able to survive the gut. And the reason is because inside of my stomach, there is a concentrated version of hydrochloric acid. Now, not concentrated, but concentrated for my body because, yeah, it's hydrochloric acid. It's not the stuff that we use in the lab. But folks, this is nothing to laugh about. I mean, this is kind of help dissolving your food, helping break down all of the nutritional content that you can absorb in those food products as you drink them and as you eat them. So the drugs also have to be able to survive that. They cannot be changed by the time they hit your stomach and by the time they go into your intestinal tract. That molecule cannot change from its intended kind of originating structure. If it does, then it's going to break down. And if it breaks down, it's going to decompose. And then if it decomposes, this easily can be an inactive drug if you are not very careful. So for that reason, not all drugs are going to be suitable for what we would call the gastroenteral or enteral processes. Next up are the perennial or parenteral. And that parenteral is going to be our liquid syringes, any type of freeze-dried, reconstituted solids that's going to happen that we're going to inject, any type of solid or liquid that we're going to inject. All of these types of things are going to go dermally. They're going to go transdermally. They're going to be injected into me. They're going to go under my skin, into a vein, into a muscle. That's what these things are. So once more, these are systemic, which means that they would spread throughout the body, and your body will pick those up, and your body will know what to do with them without a problem. And the reason is that these drugs cannot survive a gut. So if I try to take these and swallow these and do something with them, they're going to go and they're going to decompose, and it's not going to give me that active pharmaceutical ingredient anymore. It has now been destroyed. So that is why some of these types of materials have to be injected through a shot, like a vaccine, or some type of intermuscular type of injection that has to go on. So think of your flu viruses or your flu vaccinations. Think of any of those types of situations where you're going to the doctor and they're giving you a shot. Even some of the antibiotics is going to be part of that. Next up are respiratory types of classifications, and the respiratory and inhalation type of drugs are going to be in their own category, and these are things that we're going to sniff up our nose. So metered dose inhalers, nasal sprays, dry powder inhalers, all of these types of things are going to be huffed in, and you're going to take a deep breath and you're going to try to breathe in as much as possible. These are also systemic, and what that means is that they are going to be spread throughout the body, not in one localized area, and they are going to be quick delivery and short acting. So what that means is that if I need something to hit and hit fast and hit hard, then it's going to be the respiratory drugs that are going going to be doing that for me. Not necessarily the oral dose, not necessarily the injection, but the inhalation types of drugs. Those are going to be quick, those are going to deliver very fast, and they are what we call short acting. Next up and finally are the topicals, and the topicals are localized. And what this means is that I'm applying them to an area that I'm having a problem with. So think of like a sore muscle. I'm going to put some type of cream, I'm going to put some type of ointment, I'm going to put some type of patch on that sore muscle. I'm not just going to randomly put it anywhere, but I'm going to directly put it onto the area that is affected. So this is often local application, and this can be in the version of creams and ointments, transdermal patches, or drops. So some type of liquid that can be dropped onto those surface areas and rubbed in maybe. That is what these types of topicals are going to be found as. A couple of terms that we're using so far that I'm going to quickly do a review of. Active pharmaceutical ingredient, or what we call an API. And that API is any component that's intended to furnish pharmacological activity or other direct effect in a diagnosis, cure, or mitigation. So this means this is the important piece. This is the part of the drug that actually makes it work. All right. Next up is a component, and a component is defined as any ingredient. Okay, I'm going to highlight that. Any ingredient that's intended for use in the manufacture of a drug product. And that might not appear in the final product. So what this means is that I'm making a drug and there are ingredients that's going to be used in order to make that drug, but that ingredient might not show up in the final form. And that is okay. It might not be needed, but it had to be used at some stage in the process. So if it is an ingredient that's got to be used in some stage, even if it doesn't show up in the final product, this is going to be termed as a component. So everything is going to be a component. It does not matter. If it is used in that manufacturing setting, it's going to be a component for that drug. Next up is incipient, and the excipients are any component in a finished drug product that does not have a pharmacological effect. So keep in mind, this is how this is different. It is in the finished drug. So an excipient is something that is there. It is present in that final dosage form, however that comes to you. Whether it's a tablet, whether it's a capsule, whether it's a shot, a vaccine, whatever the case is, if it is present in that final form, we are going to label those ingredients as excipients. So these can be bulking agents, these can be stabilizers, these can be colorants, these can be some types of things that are going to hold those tablets together maybe. So a number of different things can be excipients, but they're going to be used because they are there in the finished product for a reason. Next up are primary packaging, and that's any drug product container, and that's going to include any of the vials, any of the syringes, any of those blister foil packs that you might see that's out there on the market. Some do not require specialized types of primary packaging and others do, but this is what we're calling a primary package. Any drug product container such as a vial or a syringe. All right, so this is going to get you started with Module 8, and Module 8, again, is going to take a lot of these ideas and wrap these concepts up together. And then in the next section, we're going to focus on receiving. So I'm going to go back to this flow chart, and I'm going to go up to the top, and we're going to talk about receiving and what's going on, and what are some things to kind of watch out for in order for receiving to do their job the proper way. So as BioWork certificate holders, you need to keep in mind that receiving is a very important job. And if you are doing that job the proper way, there's protocols that you have to follow. And we need to talk about the purpose of the receiving part of the company, because you might find yourself working for that area of the company when you do get a job and when you graduate from this class and get that certificate. So in the next video, this is where we'll pick up.